welcome.
Thank you.
So before our interview, you want to have some caffeine, but I want to ask you, did you try some Moroccan tea already?
Lots of times, actually. I think Moroccans are just very well known for their hospitality. They will not let you go anywhere without giving you tea first.
So I'm happy that you're comfortable here. So Sneha, you're a PhD at Imperial College. Can you tell us what is your research about?
Sure. So I work across the Department of Mathematics and the Department of Surgery and Cancer. And my work is, broadly speaking, in the area of machine learning in healthcare. So I'm a computer scientist by training. So what I do is I study clinical use cases which can benefit from multimodal learning, and then I try to see what adaptations you would need in machine learning algorithms to make multimodal learning effective in healthcare.
Okay, so you're working in healthcare, and healthcare is quite comprehensive field because it involves practitioners and patients and data scientists. How is your work integrated and impacting the practitioners enough, and how do you think about their perspective before thinking about what your model?
Right. So the whole point of working with the Department of Medicine was to have these clinicians, have these practitioners as our direct collaborators. So one of my advisors is a surgeon and a physician himself. So it is his job really to bring in the clinical perspective because I clearly don't have it. Although I have to say that with time, I think I'm developing a little better sense of what they mean, what kind of vocabulary they use, and that's definitely progress given where I started. And I think that is one of the first thing that comes into play when you start doing this kind of interdisciplinary work, is that you start to develop a common vocabulary. You start to at a very basic level, understand what the other field
it's like
means.
Two people speaking two different languages.
It's absolutely that, and it doesn't really, the gravity of it doesn't strike you until you really start to do hands-on work. And so that was the whole idea behind starting this PhD. Really, was to work in direct collaboration with the clinicians themselves. And not to mention that I work with the Imperial NHS Trust, which also allows me to access data and resources that come from Northwest London NHS, which is, again, a huge treasure trove. But like I said, I think the real value there comes with being able to work in close quarters with the clinicians themselves.
So you said value. I want to ask you a question. So you're working in healthcare, and obviously health is one of the most important assets any human can have. What is the value and the impact that AI can have in healthcare? How can it impact a Lambda person, basically? Both negatively and positively.
So the way I look at machine learning and that whole universe of things is as a family of tools, at least at the moment. So I'm not one of those people who sees, artificial general intelligence coming in the next 5 years. I'm also not one of those people who thinks radiologists are becoming redundant in the next 5 years. I think we're making great strides in the area, but I think it's a great tool. And again, you're probably too young to have seen that transition, and even I'm too young to have seen that transition, actually. But there was a time when, digital tools in themselves, computer science, computers were not this common, right? Everything was pen and paper. Everything was, was much more in a physical world. At some point, slowly in some fields and more suddenly in others, you saw everything getting digitized. You saw computers making their way into everything, which is how, when you became a programmer, you really weren't limited to a particular domain now. You were everywhere because computers made their way everywhere.
Kind of sector agnostic. You don't care about it.
Exactly. So when something becomes a very effective tool, I think that's what happens. It's inevitable that it starts to get applied in a variety of domains. Now, its effectiveness in every domain, I think, progresses in at a different pace, and that's what's happening. So you're seeing machine learning doing great, wonderful things as a tool in some domains, like you wouldn't expect things in language or vision to be where they are even 5 years ago. We are not there yet in healthcare, but the reasons are varied.
Yeah, what you said the healthcare is not there yet. First of all, the natural question would be why? Why you say they're not there yet, and what can we do as humanity in general to make it go further, if you want to make it further?
Again, a lot of multidimensional reasons, I think. One thing that we hear very often is healthcare is an example of a critical domain. So there is a cost to even doing the kind of empirical research that is possible in vision or language. And it's a highly regulated field, and for very good reason. I think something that affects people's lives, and it's literally a question of life and death, must be regulated. And I don't think there is any getting away from that. But I think that is part of the challenge of research. There are constraints. Healthcare has its own unique constraints. Every domain has its own sort of constraints. And so we as researchers have to find a way of accomplishing useful research under these constraints. Data, for example, is something that we hear about a lot. And this is something I'll add, really. For years, I used to give example of clinical data or medical data as an example of a low data regime in machine learning. I'm changing my mind about that a little bit. I don't think there is less data in machine. Think about it. I mean, everybody has healthcare data related to them.
The collection, right?
So it's not really so much that there isn't data. It's a question of access, and the question of access is not a purely technical question, right? So just look at the difference between what kind and how much and what quality of healthcare data you have in Morocco versus in NHS, where I work, or in North America. Who holds that data? Who is using it for what purpose? What kind of access you have? Who controls that access? And what is it being used for? I grew up in India, that's where I come from. A majority of healthcare in India is still carried by institutions which maintain paper records.
I was actually gonna resonate on that, because last year we had in our healthcare track a talk about healthcare in one of the West African countries. And when they wanted to implement a model for some prediction, nurses working in hospitals will say, we're working like this for 30 years and it's going well, so why should we change? So there's always some questions about data collection. It's not necessarily about technical issues. So do you think that's also one of the reasons?
That's absolutely one of the reasons. And I think it's like data is a very obvious point of view of looking at it. But I think there are all aspects of healthcare that are affected by it. How do people access healthcare? Who has access to healthcare? People who don't have access to healthcare in a particular country are not part of your data set. What does that do to the quality of your data set? What does that mean in terms of all these research papers we write about bias and its mitigation and, the demographic aspects of your data sets and such. So
it can have quite difficult social consequences of the imbalanced data. If you have a minority in your data set, that can negatively impact your model and therefore negatively impact people, as I said earlier, about life or death. You also mentioned...
And I also want to add, it's not just the social effect. It's also on the cause side. There are also social causes of where this data is coming from, how is it being collected, and what it is being used for, both on research and operations side. So
what kind of, can you give us some examples?
So that's what I meant in terms of healthcare access, right? Think about who has healthcare access. Think about how they access healthcare. Think about how their data is being recorded. Think about who holds that data across the world, really. Think about how it's being used. Think about scenarios where once you manage to do great research and produce great results, how is that being put to use? Think about how much healthcare ML research in North America, for example, is in the service of insurance companies and private insurance companies, since it's the US. So like all technologies, like all technical tools, these issues don't sit isolated in a technical domain. These are not purely technical problems. All technical systems are socio-technical systems.
I totally agree. You also mentioned earlier that researchers have to come up with innovative ideas for that domain. So with that comes a certain responsibility to produce the whole publish or perish aspect, and therefore a lot of pressure. How do you personally, first of all, do you feel that pressure, or is it more motivating or stressful, or a fluctuation of both? What is the mindset you're in as a researcher in healthcare?
The pressure exists. There is absolutely no denying that, and I think it'll be a huge disservice to younger researchers and people who are just entering the field or trying to enter the field if we give them this disingenuous advice that publish or perish is not a thing. It shouldn't be a thing. That is absolutely true. But those pressures exist. I always hesitate to answer these questions from a personal point of view because what has been a good course of action for myself may not be a good course of action for others. And my route in the research world and my career in general has been very circuitous as well. And the way I've devised my work and my career plan, well, I say devise as if it's all of it was planned. Some of it was. I think personally for me, it comes with an understanding and acceptance that yes, I'm not after the Turing Award, perhaps, but I do hold it important to myself to do useful and meaningful work on a day-to-day basis, and yes, there are multiple misaligned incentives in the research world, and I think when a field grows at a rate and with the kind of hype that machine learning at large has, I think some of it is inevitable, and the way to avoid that is really for both the senior members of the community and the new, younger, fresh blood to sort of be aware of this and try to mount a resistance. Again, none of these things happen from one corner or through one person. It is a collective realization and action that works.
Well, I personally hope that your research would be impactful and can help people's life. I would like to thank you for your presence today. It was lovely to have you, and thank you for listening to us.
Absolutely, my pleasure. Thank you.
Thank you.